Hello, good afternoon, ladies and gentlemen. Veronika Jakl is an industrial and organizational psychologist in Austria, carrying out interventions on war-related stress in private companies and also in public organizations. So with this panel, we will already start with the first trial question to test the voting paths. The question is, what is your background, your personal background? As you see, you have several options here. 1, labor inspection. 2, government representative. 3, OSH services and insurance. 4, worker representative. 5, employer representative. And 6, other. You will have around 10 seconds to vote through your paths, and the vote can start right now. So you take you see the time passing. And we will see now the results. Majority of government representatives, interesting, followed by other. Very briefly, what the others are. For instance, some of the other respondents. Others? Research? Psychologists Association? Non-governmental NGO. Okay. You see that 17% worker representative, labor inspection the same, 17%, and or service or insurance, 10%. Okay, we have already a first overview of the composition of the session. We can go to the next question. And in introducing the question, let me tell you something. In SNR, in the results of SNR, there is a big variance between 4 and 60% in the use of psychologists for psychosocial risk prevention in the different member states. On the basis of this big variance, the question is, should there be greater provision of professional support by psychologists? And you can reply, 1, yes, where possible. 2, perhaps decisions should be taken jointly by the employer and employee representatives. 3, no. And 4, other. You can vote right now for 10 seconds, please. So, majority of yes, where possible, followed closely by perhaps decisions should be taken jointly by the employer and employee representative, and 1 out of 10 is a clear no about the greater provisions of professional support by psychologists. Veronika, you are our Austrian psychologist, and you have something to let us know in this respect. Please.
Thank you very much.
You are welcome.
Hello. The answers of you make me very happy. Thank you very much. For the great majority who also says there should be a greater support by psychologists. I am a freelance psychologist, working psychologist, and I also support companies and all the institutions to help to get this psychosocial risk assessment. And when I go into companies and I see the staff and talk to them, every time they have a little bit of fear or more fear when they see there's a psycho professional coming into the company, and they are very afraid because the employees are afraid they're getting analyzed like Dr. Freud, and the employers are also a little bit afraid, and they don't know, okay, what can a psychologist do here with my company and with my workplaces. And there's also really strange views what a psychologist does in such a project and what we do when we set interventions. Employers are also afraid that I will insist on every absurd idea the staff comes up with. Like when the staff says in a workshop, we all need parking spaces for everyone, and that's what a stress factor every morning. And then the employers are very afraid that I will insist that everybody needs a parking space, but that's not a fact. And I have to clear this up, that this is not my purpose to set here through all these wishes. So it's very important for me that also the employers and the employees, they have both a good feeling when working with a psychologist. That it's very clear for them what we do, what are the purpose of such a project is. Because I have the staff always always involved with a survey, or I see them in an interview or in a workshop. And I also have the employers, because they pay me, and they also need to have very good feeling when working with me. I think professional support is very important to get an objective view on the workplaces. And it's easier also for the companies to focus on these psychosocial working conditions and not on individual complaints. You have to defer this. And it's also easier for them with professional support to set condition-focused measures and not just like, okay, maybe we should do some training. And that's just the global perspective everybody comes up with. But you need to have professional support to set really good and effective measures and to help you to get a view from outside. And it's also easier for me than from someone who is in the company to speak openly about problems. Because I can talk nearly about every stress factor because I see them from a different point of view than the staff does or the supervisors do. And that also helps within such a project to keep a clear view on these psychosocial risks. Yes, in Austria the law changed 2 years ago, 2013, basically like in Belgium they did. And now it's also explicitly this psychosocial risks included. And from this day on, a lot of professions also get basic training for this psychosocial risk assessment, not only the psychologists, but also the occupational health doctors or safety officers. And that's very important in my point of view, because I think that's a good way to get the knowledge into the companies, because these other professions are often permanently integrated into the company, and they also have the respect of the company owner, for example. And then it's easier to transport our message. And then when they have a very complex problem or when the project is very big, then comes to the point when they add a psychologist to the project. I also understand that not every employer wants to buy a psychologist because they also have to spend the money on them for such projects. But after every project I did, really after every one, the managers told me that they were very happy about it. They get a very deep insight into the company, into their own company, and they really know more about their own company than they did before. And it was also better because they cleared now what stress factors are within the workplaces or have been. So for me, it's a very clear yes. The provision of psychosocial help from a psychologist is a good thing. And maybe it's a first step to get transported the message via the other professions which are already in the companies.
Thank you, Veronika, on this interesting... Thank you very much. Questions, comments, or remarks about this important topic? Please.
Thank you. My question would be, we had the presentation of the labor inspector, right? And that's based on legislation. So going to the workplace and looking, is this workplace following the law or not? Should things be changed? So what is your leverage as a psychologist when you come to workplace? I don't, you started explaining it, but I would like to hear more about this. What is your leverage that you have? Because you're not, in the end, if the company follows this or not, there's no legal obligation, and you know your report, or is there? I don't know whether there is, but to implement what you see, right, and to apply. Yeah.
Okay. In Austria, the whole responsibility lies within the company. So the labor inspectorate comes also to the companies and talk to them if they have to do something very special, or if they also have addressed already these psychosocial risks. And if they see a lack here in the risk assessment, then they tell the company, okay, you have to do this risk assessment on psychosocial risks. And then the company has to see whether they have the knowledge to do it by themselves, or if they know, for example, an OSH doctor who can do this for them, or if they have the need for a psychologist. And that's when I come into the companies, then I will help them to do this risk assessment. And I'll also help them to go with the project. In the end, I can also give them advices. But in the end, it's all to the supervisors and the company owners to do so. And also to the labor inspectorate to say, okay, you have to follow these advices, or you can also do something different if you think that this would be better. But there's the obligation to do something about it and to assess all these psychosocial risks.
Thank you, Veronika. Next one, please.
Thank you, Veronika. I totally agree with you.
Thanks.
But could you please give us some examples of intervention programs after assess the psychosocial risks?
The measures afterwards.
Okay, thank you.
The measures after such a psychosocial risk assessment are very often very small and absolutely without costs. Often it's about getting the work organized differently, to talk openly about the work organization, or what the tasks are, or how the tasks are also here within a team. That's a very big part of it. Sometimes we see that there is some training needed because there are special situations the staff can't deal with. But that's just a small part of it. Mostly it's about organizing work better.
Thank you. We have time for one more question. Rebecca, please.
Thank you. As you mentioned, of course, this has a cost for the employers, particularly smaller companies. And I was wondering, how do you convince them that they need you, I suppose, is the question. How do you show them, I suppose, from a qualitative, but I guess also from a sort of spending point of view, that the cost can be outweighed by the benefits that they can have afterwards. And perhaps related to that, of course, in some cases, these issues are dealt with by health and safety representatives, but they can also be dealt with by human resources managers. Or I'm also thinking in larger companies where it's not a legislative obligation, it may also be dealt with by corporate social responsibility departments. Who do you link up with most, and where do you see differences in terms of the route that you go through within the company? Thank you.
Okay, for the first question, for the cost, that's a very hard part. You can tell them from the numbers we heard before in the session that there is, from a scientific point of view, it's very obvious that it gets in the cost. The return on investment is very high for these psychosocial risks if you assess them and get interventions. But for most company owners, that's like, okay, scientific cloud. They can't go there. So mostly you have to have someone within the company who has a feeling for this topic and also sees that there is a need to do something. Maybe they have a very high turn-on rate or a very high days of sickness days. Then they see that they need to do something. Or if the stuff changes very often, then it's also something where they see, maybe there's something going wrong and it has nothing to do with the other risk assessment they already did. And then it's easier for them to see the advantages of buying a psychologist and my services. But often it's the managers who see it just afterwards, after the program and after the project. They see what it was all about. And then it's also easier to get the mouth-to-mouth feedback. And then one company owner says, okay, I did this and it was very good, and tell this to the others. Or also, as you mentioned, the HR professionals, they're also linking up together, and then they also can tell about that there was a very good project they did, and then it's easier for them. You also asked to which professions I'm linked up within the company. That's very different. With all the projects, they're mostly HR representatives, the safety officers, or also the doctors. Sometimes, as you mentioned, corporate social responsibility professionals, also had them too. So it's very diverse by now.
Okay, thank you very much for your questions and for your replies, Veronika. Now it's time for a summary and for wrap-up of this very, very interesting session. Thank you to all of you and to your interventions. I will try to make a short summary of what was mentioned here. A lot of information, but trying to focus in the most important elements. Across Europe, there are many initiatives on psychosocial risks, from legislation to inspection campaigns, provision of tools to motivational approaches. Stakeholders in member states can and hopefully will learn and be inspired by each other. And this discussion is a good example of that. Regarding the topic of legislation, some countries like Belgium and like Sweden have adopted legislative measures regarding psychosocial risks. And in our discussion, it came out that one of the main challenges of the legal approach is to have an appropriate definition of the topics to be dealt with. The approach should be focused on prevention. Prevention is the key element in these legal initiatives. And certainly, employers and workers really need tools for useful tools and practical tools for implementation. Regarding inspection, we see that there are different approaches and different initiatives on inspection, and measurements of inspection impact is difficult. Psychosocial work environment depends on much more than inspection, but improvement notices and repeated visits and guidance, good and practical guidance, is really useful and helps to reach these objectives. Regarding the sectoral interventions, it is clear that social partners need to be involved in interventions. Sector interventions raise performance above the baseline, whether the intervention in tools, whether the intervention is focused on tools on publications, or on trainings. Involving educational settings is important in this changing of prevention culture, in particular in the sectoral approach, and in particular in small companies. The changing of the culture needs a lot of education and specific actions in this respect. Very interesting reflection about the psychologist support in companies. I noticed that after receiving advice on possible intervention from a psychologist point of view, managers usually have a very deep and useful insight into their own companies. It's a good way of knowing better what is happening and what is going on in the organizations. Support of a psychologist helps to find the right measures in the organization. And mostly measures focus on organizing work differently and often don't go along with cost. Usually only the fact of being able to openly discuss about organizational measures is something very positive for companies. About motivation, it was very interesting to know and to see that stress and psychosocial risk have a cost, a very substantial and sometimes enormous cost for companies. Regardless of the source of stress, it is clear that it's very costly for businesses. Showing that the element that this is very costly can in itself motivate employers. The more chronic the stress is in companies, the more cost it represents for them. And it can be useful to use effective tools to measure the stress. This was a part of our very fruitful discussions, and with the positive message I would like to conclude is that it is possible and it is necessary to act in these regards, in psychosocial risks. We have learned different experiences, different approaches in this respect, and the positive message is that stress and psychosocial risks can be effectively managed. My last word is to say many, many thanks to all of you for the very interesting presentations